Hello, good afternoon, and welcome to Trachoma Live, a series speaking about the project End Trachoma by 2020 and what it involves. Today I have a really special guest on for you. She isn't able to join us live, and we have pre-recorded this interview earlier, but I felt that it was really important for Professor Kerry Arabena to have a voice on this particular topic, which is working with Indigenous people. What does it mean? Professor Kerry Arabena has a doctorate in human ecology. She has a degree in social work, and she's the chair of the Indigenous Health Equity Unit at Melbourne University. She's a descendant of the Meriam people of the Torres Strait, and she has made significant contributions to Australia in terms of social justice, health equity, gender issues, just to name a few. She's an incredible woman. She's a prolific tweeter, and if you don't follow her yet, follow her now, because she is an incredibly inspiring person to listen to and learn from. I will be showing you the video shortly of our conversation earlier. Please welcome Kerry Arabena. Thanks for joining us. I know you're up in the Northern Territory right now. What are you doing up there?
I have had a really wonderful couple of days travelling around to different communities in the Northern Territory. And although I hate doing the fly-in, fly-out piece, I actually apologise to the people for that, but did explain that the concept that I was talking about, first 1,000 days, which is looking at the period of time from preconception, conception through to age 2, is a really important period of time in which we can do some really amazing things for our families and for our children.
In one of our first meetings actually around our project, End Trachoma by 2020, you had told Rob, or you had told all of us actually, that you had actually had trachoma as a child. Can you recall that experience for our Rotarians?
Yeah, for sure. What happened was I ended up working in a remote area community about 600 kilometres west of Alice Springs. It's called Kintor for those people who might be aware of it, or Wallangaroo, which is the traditional name for it. I went out there as a 21-year-old to run the most remote area Aboriginal medical service in Australia. And I had a staff of about 17 people across that and the Women's Council. And together we were doing primary health care work, except that what we found was that the environmental impacts of health and wellbeing was something that were outside of our scope to be able to cope with. And so we had to really establish a partnership with council. And that was around dust control, trying to get the dump covered up with all of the materials there because it had a lot of flies and things like that. But because of the intensity of the sunlight and the combination of these environmental factors and how that played out for me, I actually ended up with early stage trachoma, in that all of the underneath of my eyelids was scratching up against my eyelid. That's what I went into the doctors and said. I kept on rubbing my eyes. They were getting incredibly sore and really aggravated. And I just said, my eyeballs are incredibly sore. And it wasn't until my lid got flipped that they said, you've actually got early stages of trachoma. And that was actually a really big moment for me, because even though I was working in health and I had some element of control in the context of the health service, the circumstances in which I was living were beyond my control and required a whole of community effort to try and align the environmental health with the primary health, with the circumstances that people were living in their houses. And that's what I really love about the 2020 trachoma work. It's the same way in which I do my work with First 1,000 Days, in that we look at the interface between public health, households, culture, law, good primary health care interventions and trained workforces. And I'm really just so happy that even though it was 21 years ago, the doctor that I went to see at the clinic understood what trachoma was, and they could tell the early signs of it, and I had an appropriate intervention and was able to not progress any further, thank goodness.
As an Indigenous person, you have worked in this space for a very long time in the practicalities of working with communities, as well as bridging that gap with bureaucracy and the government and the institutions. Can you sort of talk through with us what your expectations are as an Indigenous person when you work with non-Indigenous people or institutions?
It actually physically causes me hurt when people can't be respectful of my difference and my aspirations for a unique cultural community to not be acknowledged. And so I really choose not to work with people who perpetrate harm and who don't demonstrate respect.
Yeah.
For me, that's absolutely fundamental to the quality of the relationships that I have. And I work with non-Indigenous peoples who have decided that their life work is around giving their skill set and their knowledge and capacity to Indigenous people to make sense of that in our context and then to bring the very best of themselves to the task at hand. So I work with a lot of researchers who've been trained in epidemiology, in microbiology, in social sciences, in transformational activities, in positive psychology, and each of them have spent years honing their craft. But when they become engaged with my community, it's almost like I'm saying to them, we love what you have, but what we're really interested in is the quality and characteristics of who you are and how much you can hand yourself as a skill, as a tool and a resource for us to mobilise resources to where they're needed. Mm. And so it's just been a fascinating journey when people lend themselves to our form of community control and our form of leadership. The changes and transformations that happen within them as a person is something that we cultivate. We cultivate loyalty. We will be loyal to you and we expect the same. That respect, we'll respect what it is that people bring and we encourage them to bring their very best. And then I personally make sure that people thrive and flourish. That's something that I really have benefited from in my life and something that I like to be able to give other people the experiences of. And then the other thing is it's really important not to assert what you know because there are so many things that you don't know. Mm-hmm. And the first and most wonderful experience, and again, I'm living it right here in the Northern Territory and in other places where I go. But the first thing that we need to do is just listen and cultivate the relationships that engender that trust and respect. And I think, again, what Rotary can do in this space is think about what it means to be my fellow Australian, which is very different to understanding your privileged position in an Australian context and then being of benefit to others, like from a top-down kind of approach. Yeah. It's a lot of the successful work that gets done comes from the ground up. And I think the Nobel Prize winner Sen's work on human flourishing and what it means for people to do that, it's around having a meaningful life where you feel empowered through the contributions that you're able to make and that you're able to realise your own life's purpose. Not everyone's going to have the life that we want for them, but facilitating people to have the life that they can have is just extraordinary. The other thing that I think is really important in that is that we are already resilient. We are born for resilience. We are born for strength. We are born for courage and purpose and contribution. But there are a whole range of circumstances in our life that have meant that we haven't been able to fulfill that promise to ourselves and our families. And the genesis of some of those issues that are complex and difficult didn't just emerge in this generation. There's actually 2 or 3 generations before where that trauma, where the policies had an impact on people's capacity for parenting and all of those kinds of relationships over time have meant that the current circumstance that we're in is probably going to take a generation to shift. And so whilst there are things that can be done quickly, there will be other things that will take time. And so that sustained, consistent approach is going to be what's required. And again, legends in the trachoma field didn't walk away when it got too hard. People in the trachoma field stayed for their long term, and some of them have given their whole life over to this kind of work. And it's so empowering to see people who make their life work of it and are in for the long haul, not for a short term. Experience We're not here to give you an experience. We're here to transform the Australian nation and to achieve equity, because we all deserve that.
One thing that we've talked about in our conversations, Kerry, that you haven't yet touched on, and I'm not sure whether it was something that you were going to before I'm cutting you off here, but we talked about thinking about people's aspirations and who they want to become and how we can facilitate that as well.
Yes. I think aspirations are so important for people to have, and I think secretly they have them, but have very few opportunities to have them articulated and then to have them realised. And a lot of the effort goes into identifying a problem or a challenge and then solving it. And what we're doing in First 1,000 Days is actually saying we're not interested in that. Everyone experiences vulnerability. Everyone has problems. Everyone has issues that they need to deal with, and some of them are deeply burdened by their experiences. And those things transcend race, experience, geography. It's absolutely essential to what it means to be human. It's also essential to be human, to have a hope and a dream and to have them realised. So in our work, we're mapping a community's aspirations. So for the first time, what we're going to understand is what are all the 14-year-olds in this community have as their hopes and dreams? What do 25-year-olds have? What do parents have for their children? And what kinds of aspirations then do they have for their entire community, which in my view is the combination of all of those different aspirations together. And what we're doing is really reorientating services from that deficit language, meeting a need, to actually understanding what the hopes and aspirations are in the communities and going through and addressing and identifying them. We did this in Whittlesea, and it was really incredibly powerful, because what we also did once we identified these aspirations is hook them up with life coaches and mentors to help them realise it. And through our work with Aboriginal Housing Victoria, we've been able to identify over 100 aspirations and have them met in a very short space of time. And they are small things. It is more about, I want to have enough money so that my child can go and participate in this sports carnival and have access to a uniform. I want to be able to get ready to go to work, and I can only do that in a part-time capacity because I need to be here to care for my mum and my cousins. Or I actually just want to be happy, and the places I feel happy is out on my back veranda having a cup of tea in the morning before everyone wakes up, because that's my one time in the day where I know I can experience peace. Mm-hmm. These little tiny things that are very much a day-to-day, I don't think we get a chance to talk about enough. And I don't think we get a chance to hear enough, because we are so busy doing that we forget what it means to be. And I think that that's something else that's really fundamental to the way in which we engage people. We come to communities with our sense of busyness and purpose, and they have their lived experiences of what it's like to be in that community. And matching those two things up, I think, is really an intersection or an interface that in the last sort of decade's worth of policy we haven't had a chance to realise. And I think Rotary's got a really strong role to play in educating others about how to do this work well. We're not empowered service seekers. We're not empowered only to access a service. We should all be empowered to be great citizens of our own nations, those places from where we came. And in an Australian context, there are over 300 separate individual nations of people. And we want to first be able to make contributions in our own nations. And then I think from that point, once we're strong there, then we can actually contribute to the Australian nation. And those two sort of national discussions are so empowering. And it comes about from a family. It comes about from a household. It comes about from working with children. It comes about being a generous benefactor of things that you can make happen. And that's what else I've loved about most of the Rotarians that I've met. And I haven't met all of you, sadly, but the ones that I have met and the ones who align with your values, and then people like you, my sweet sister, who have been employed by this organisation. I think all of you have just got that incredible generosity of spirit and the kind of courage to articulate what needs to happen and the personal motivation to get resources to where they're needed, that's more about giving a hand up rather than a handout. We don't want a handout. We're actually sick and our families are dying from the handout, from being over-serviced. But to actually stand strong and to change from being an empowered victim to being a self-determining person is bloody hard work, and it is not joyful all the time, but you get the chance to live your life under your own authority and under your own abilities and passions and your own sense of creativity. And I just love to work with organisations who can actually make that manifest in themselves and then be role models and benefactors to others to make that happen too.
Thank you for joining us, Kerry Arabena. We've loved having you on. Love our chats every time. And good luck. You're off to Groot Island next, aren't you?
Absolutely, off to Groot Island, talking about first 1,000 days there. And again, the way we work is like Rotary, by invitation. We don't go into places where we're not invited. And talking about family strengthening and what can happen in that space is something that both you and I do have in common. And I'm really deeply motivated, like a lot of Rotarians are actually, by just the sheer volume and number of young women around the world who can't live the life that I have led. They haven't had the chance. They haven't had access to the education. They haven't been able to access employment. They haven't been able to look after the children who've been born to them. And there are just so many women who are voiceless. If you've got a voice, then, and you've got will, and you've got this great nation to actually be part of and to contribute to and to make sure that everyone around the world has that same kind of opportunity, then who are we not to?
And that was Professor Kerry Arabena from the Health Equity Unit at the University of Melbourne there. She has some great nuggets of wisdom. I certainly look up to her as a person who has a lot of wisdom and who really understands the scope of our situation in Australia. Look, I have the day off tomorrow. Join us tomorrow on Trachoma Live. You'll meet the directors of the project, Dr. Murray Verso, Kerry Kornhauser and Rob McGurk, and hear from them about their perspective on the project, how it came together, and what their vision is for the future of the project and for ending trachoma in Australia by 2020. Thanks for joining me again today. I hope you've found this series useful so far, and I've been really happy to be able to present it to you. So thank you. Bye.